Let's get this going. Alrighty, man. We live. Sorry, no video cam today, no face cam. I gotta find it. Room's a mess. Gotta clean it. So it's gonna be just me rocking out by myself again. Have uploaded in a minute, but we back at it every week, starting this week. I know I said that a couple weeks ago. Stuff has just kept happening. So I'm gonna keep going, keep trying to push as hard as I can to get this done. So first video back from season 2 was a opener about, in all honesty, I have forgot it. It's been a while. I'll have to revisit the video, but you are more than welcome to click on the video yourself. That's the best way to find out what I do, what I plan on doing, and furthermore, I will be posting on social media with my upload schedule and for you guys to see what's going on in the life of the Mac, the life of Black Little Mac. But for now, what we're talking about today is, at first, and I'm not gonna lie to you, at first I was gonna talk about the following up from a couple weeks ago's video with the lack of a mother's presence inside of a child's life. So that one fell really flat because of the fact that the only viable evidence that I could find on the lack of a child's health, the lack of a mother affecting child's health, is the fact that the child is more unsociable, more or less not tame, really crazed, cringed, and kind of a whole slew of other words. Not even words, a whole slew of other mental disorders, and they just don't have sympathy. It's the best thing I could describe it as. But today we are going to be talking about something that is swept under the rug for our Black women, and if you deal with these issues, please go ahead and get yourself checked out, and that is the health of Black women. This episode will kick off a maybe 2 to 3 part episode, 2 to 3 part series that I will be having on the health of Black women, maternally, physically, emotionally, psychologically, just kind of going through that bit of motion going forward for the next couple episodes. Now this is part 1, so I'm gonna give you like a brief overview. I don't want this one to be too long because I really want to get other people involved in this, and then kind of talk about it in the video about what I'm gonna be planning on doing for the next couple videos, and again posting on social media. And so if you follow me on social media, if you're friend of me on Facebook or anything, you're gonna know what I'm doing. All right, so by the end of this week, so today is Friday, was dipping into Saturday now. By the end of this week, I want to say most definitely Sunday morning, afternoon, cannot describe which one, you should have a whole allotted proof, not a proof, but diagram or document detailing what I will be uploading, when I'll be uploading, and when I'll be recording and doing research on certain days. So this is what I'm going to plan to get to you guys. More on that at the end of the video. But now let's get jumping right into it. First thing I want to do is discuss the overall bearings of health for women. Health for women has been a main issue for a long time. It used to be far beyond anybody's knowledge or lack thereof that women wouldn't able to get medical treatment in such a high fashion as men would. Good old American hierarchy or whatever SJWs want to say it was. But the fact of the matter is that men were valued more than women because we were seen as the ones that go out and go get things done while women just stayed in the house. So fast forward to 2019, 2018 eras, and we're starting to see, this slightly deviate, but still kind of has a hindrance to everything with the, inclusion of a lot of different media, well, not different medias, but different medical institutions and everything else to help women be healthy and live happier lives. It does improve their health significantly, but there is still problems in it. So today I will be looking at 4 different sources on women's health, and we're going to be reading a bit of the articles. I'm not going to dive too deep into it because, again, I do have a part 2 or 3 that I will be doing to this, where I would dive more in depth to each topic of discussion. So, first comes from womenshealth.gov, 30 achievements. So these are just things that have been being addressed for the minority woman's health. Minorities, of course, being the minority inside of America. As you see, this is also sponsored. This is on the U.S. Department of Health and Human Services tab. This is something that, for all intents and purposes, is for women only. I can get the analytics of that. So let's go ahead and dive right into it. So this is brought to us by the Office on Women's Health. And if you need it, you can always call this hotline just right there. I'm going to leave it in the description below. If you are feeling a little bit nauseated or anything and you just don't know what to do, go ahead over to the OWN. Call this number and they'll help you win. That was lame. That was really lame. But anyway, backstory for them. They spent over 30 years to improve the health of all Americans. In 1985, HHS released its first ever national report on the health of minorities. The report of the Secretary's Task Force on Black and Minority Health. At the time, this landmark report, 60,000 more deaths occurred each year in minority population than in white population. The reports resulted prompt HSS to establish the Office of Minority Health in 1986. Over the years, OMW's campaign and programs such as National Partnership for Action Plan have helped raise awareness and work to overcome health disparities for minorities. Improvements in health care have led to reductions in, and in some cases, limited disparities in certain areas, such as, getting mammograms, screening for breast cancer, treatments for antibiotics earlier, seeking counseling for smoking, you name it. You name it and they got it. So, I keep scrolling up and down. So just kind of give a basis of it. Today, and this is from back in 2014, I just want y'all to know that. So, in 2014, some minority women have longer life expectancies than white women. Latinos in America have the longest life expectancies, being almost 84 years old compared to 81 in white women. Hispanic American Indians and Asian women all have a lower death rate from heart disease compared to white women, and lung cancer deaths since 2003, while breast cancer deaths let me backtrack. Lung cancer deaths have been declining for African American females since 2003, while breast cancer deaths have been declining amongst African American women since 1991. The overall health of American women has improved over the past few decades, but not all women have benefited equally. Minority women have experienced similar declines compared with white women in leading causes of death, but serious health disparities still exist. Many minority women continue to lag behind white women in a number of areas, including quality of care, access to care, and timeliness and outcomes. Although there have been improvements to minority women's health, we still have a lot of progress to make. Okay, so that's where it gets in. That's where the key factor gets in. And if you remember me going on a rant or maybe even a little bit of a talk earlier on in the podcast history, if you go back to it, I talked about the mental health of black men. So, and the lack of resources that they do have available to them to get help for it. As again, being closed off and, being not able to speak on certain things emotion-wise. So there's a lot going on. So it's the same for minority women. When you do not have the quality of care, access to care, or timeliness and outcomes that you would need to survive, then it makes it a lot harder to survive. For example, say in a white community, right? You have a hospital that's in range or less than, I'll say, 10 miles from us. In the black community, we usually have to travel a bit longer, and even 10 miles is a stretch, less than 5 miles. We either have to travel about 10 to 15, sometimes even 20 miles to get to a hospital. On top of that, there is no clinics. There's not many clinics in black communities anymore. You do have like clinics sprinkled out through there. I know personally in St. Louis, I know a couple that are in black communities and some that are not. So it's still kind of a iffy thing. Quality of care is a really, really big thing. Okay, so quality of care is the amount of attention that is paid to your certain issue versus everything else. So if you're sitting there telling the doctor that this hurts, and that hurts, well, all the same, like, oh my God, I really need to get this done. Oh my God, I got to, well, not even get this done, but I need to tell somebody about this, or maybe I should just keep it quiet. These are thoughts that go through women's heads at all times during this process. So to overlook that those happenings in in minority women makes it a lot harder for them to get rid of these disparities when it comes to healthcare. And then sometimes the outcomes don't even be different. Like, they will analyze you for one thing and not check for everything else and just call it a day. Like, you will go in with a cough, they'll check for any flu-like symptoms. Guess what? You got like pneumonia or some STD from somebody you just picked up randomly or something around that nature. And now they don't catch it until the last minute. It's because they're not looking for it. They're not avidly looking for it. So when it comes down to that, ladies, please make sure you take care of yourself. Get checkups regularly. Have them test for everything. If they don't think that something is wrong, but you know that something is wrong, trust your guts. Trust your guts completely, because they're not going to literally care about you past anything that you say. So if you tell them nothing is wrong, they will think it's nothing is wrong and continue with their business. All right. The next thing, something kind of very close to my heart. Something real close to my heart. Something real close to my heart. Is I'm going to just kind of talk about a couple things. One of them being the eight health conditions that disproportionately affect black women. Now, this, for my black queens out there, I want this to be specific towards you, because I want you to kind of hear what I'm saying and get some things checked out if need be. No matter how young you are, it's never too early to get checked out for some things, or get regular checkups. So, number one, heart disease, stroke, and diabetes. This is a really big one. All right, and remember this, and I'm gonna just give you a heads up, guys. This is a study from 2017, so it's a couple years old, but this is really a big one, even by today's standards. Even 2 to 3 years later, we still have this problem. It really needs to stop. We need to stop consuming some of the things that we do and doing everything that we do. I know with heart disease and diabetes, those are somewhat generic. I mean, not generic, but genetic, conditions, and they can be met with and dealt with earlier if, properly treated. But stroke is used, if I'm not mistaken, is just a condition that affects the cerebral cortex, or just the brain in general. I'm not going to just list off the specific parts of the brain, but let's get into the statistics. What's what you all here for? So in 2016, well, from 2011 to 2013, around 7.6% of black women had reported having heart disease, compared to the 5.8 in white women and the 5.6 in Mexican American women, according to the Centers of Disease Control and Prevention. In 2016, around 46 out of 100,000 black women died from strokes, while 35, comparatively 35 in every 100,000 died in white women. Or white women. And while white women's diabetes diagnosis rate is 5.4 of 100, That number is 9.9 per 100 for black women, according to the CDC data from 1980 to 2014, where it almost doubled. So let's just look at this pie chart. Just look at this pie chart. Heart disease incidence rates. Legitly. Come on now. This is like absolutely bonkers. This is crazy. It's crazy. It's one of those instances where you gotta take care of yourself, man. There's a danger for everything. Danger for everything. So it's just crazy. Another thing is breast cancer, and this is where I will stress this to the end of time. Please go get yourself checked with a mammogram. It's gonna hurt because they put in some sweets in your breast, but it's gonna save you in the long haul. You don't want to wake up to a lump and try to figure out what that is. So you got to take care of yourself before you take care of anybody else. Saying that is the number 2 reasons why they aren't diagnosed, and they're not gonna look for it because again, it's easy just to say it's whatever. But you gotta make sure you get yourself. Cervical cancer is something else. You gotta go to a NYG or gynecologist. I forgot the whole name of it, but a gynecologist at least every 3 months to get checkups, or it was either 3 to 4. I can't remember, but go and get that checked up because that is something that could happen. And cervical cancer goes really unnoticed in the black communities because we don't have access to it. Again, going back to what things happen, what conditions that are met with to black women or women of minorities, because we don't have access to the things, the equipment needed to test for and acknowledge these things. So, research in January, and this is all again from 2016 to 2017. In the journal Cancer, found that not only are black women more likely to die from cervical cancer than women of other races, they're also 77% more likely to die from it than experts previously thought. Prior estimates said that 5.7 black women per 100,000 would die of the disease. It has almost doubled in the past 3 years since this was done. Not even 3, 2. So it was at 10.1 in 2017. It's probably been gone up from here, but it's whatever. See, and again, this is something important. Unlike breast cancer, cervical cancer is absolutely preventable in this day and age because you just have to get checked. It's a big thing. People just get checked. It's not gonna hurt you. I promise you, it's not gonna hurt you. No woman should be diagnosed with cervical cancer, and that's just a fact. Just get checked. It's partly because the HPV vaccine is excellent for preventing infections of certain strains of human papillomavirus. I'm not gonna even try to say that again, but just HPV virus that can cause cancer. But as of August 2016, only 6 in 10 girls ages 13 to 17 and 5 in 10 boys of the same age range have started the vaccine series, which doctors recommend getting before 26 for optimal results. Racial disparities, of course, are relevant here. A 2014 report done by CDC showed that around 71% of white girls same age range have completed 3-shot series compared to 62% of black girls in the same age group. Changes recommendations in 2017 as it is necessary to get 2 doses for optimal protection if the patient is between 11 and 12, but 3 is still optimal and ideal for a patient between 15 and 26. Timely pap smears. So these are things that get into preventing it. Timely pap smears are something that can prevent full-blown cervical cancer. A pap smear will detect pre-invasive cervical cancer, but studies have shown women are having pap smears may not get appropriate follow-up. Dr. Phillips says a number of barriers exist to prevent follow-ups, and African American women may be more vulnerable. So it's just, once you get it, you gotta follow up, man. Once you get it, you gotta follow up. You just gotta follow up. That's it. That's it. Fibroids are three. This is weird. So apparently, black women are 3 times more likely to, die from fibroids in the it's just a tumor, an unconscious tumor in a uterus, and it's something that doesn't get caught, obviously. But I would say the other 4, just kind of give a quick overview of them, because I don't want this video to be too long again, because I want to explain some things to you guys at the end. Premature delivery, that's the big one. If you do deliver prematurely, it's a lot. There's a lot to go through. There is a lot to go through. Alright, preterm birth rate. Being born prematurely or before 37 weeks of pregnancy increases a child's risk of breathing problems, long-term development delays, other worrisome health issues, and even death. Sad. Okay. That's pretty unsettling if you ask me. So then after that, we do have sickle cell disease, which is something that it really goes under the radar because we don't check our blood enough. So we do have to get our blood checked, especially my black women. So with that, I think I'm going to leave it there. And the other 2 are mental health issues and mental health issues, and if I'm not mistaken, single cell. No. I know it's mental health issues, number 8, and for number 7 is STDs. Something that people don't get tested on, or something that people should be tested on. STDs, single cell disease, blood diseases, cancers. We need to get checked on these things, especially when it comes down to our black women. You need black people in general need to take better care of themselves so we can live longer, we can have better experiences as people, and to get to know and grow and learn each other, and just sing kumbaya. But that's something that we got to get to. We need to get to getting checked and everything of that nature. So we're going to jump from that to pretty much talk about the maternal health for black women. Now, with the maternal health for black women, it's a little hard because most black women kind of grow when they're pregnant, they're in a stressful situation where the father may not be there, or some other stressful indicator or trigger, I would say, that causes them to be stressed. So what we're going to do is going to read a little bit from why black women are at such high risk of dying from pregnancy complications, and this is presented to us by heart.org. Just kind of give you a few overview of it. Beyonce, Serena Williams, 3 times 4 likely to die from pregnancy-related cause than white women. According, is climbing since 2016. Basically, black women are undervalued. They are not monitored as carefully as white women are. When they do present with symptoms, they are often dismissed, which is the sad reality. Black women are often dismissed over their claims that they are sick or something is wrong, because that's just how people are, or at least white people are. It's like, you're not really sick, you're just thinking, you're delusional. Even black people dismiss this idea. So pretty much, in the end of the day, to keep myself from sounding redundant, take care of yourself. This kind of stuff I've been seeing all over the place. We need to really get down to the nitty gritty and take care of ourselves and make sure we take care of each other. So with that, I'm going to leave. It's real late. It's like 12:39. I'm extremely tired. This will be uploaded tomorrow. Again, check my socials for everything. Like, subscribe, share, and I'm gonna get up out of here before I have an aneurysm or something. Peace.